disease is the #1 killer for women, so it's a big priority for women. What we're also finding out is that there's this subset of women that have not really been adequately studied yet, but incur a tremendous risk and burden from heart disease, and that's young women, meaning women who are 18 to 55 years of age. And studies have shown that in this group, a young woman is twice as likely to die as compared with a similarly aged man who's hospitalized with a heart attack. I think this 5% of younger women is very important to study because we know that young women seem to have a worse outcome as compared with similarly aged men. Among young women who are hospitalized with a heart attack, they're twice as likely to die in the hospital as compared with a similarly aged man. And even when we look 2 years out, young women are 50% more likely to die as compared with a similarly aged man. In general, women are thought to be less likely to have traditional chest pain. By traditional chest pain, we mean that feeling of an elephant sitting on the chest. In fact, women often describe things that are jaw pain or neck pain or things that are a little bit more diffuse. It's more challenging to be able to put together a large cohort of young women. So in order to do that, we actually enrolled and identified young women who had a heart attack from over 100 hospitals in the U.S. This was part of a study that was funded by NIH, specifically to compare the presentation, care, and outcomes of younger women as compared with younger men. I think another issue that is important is to raise awareness for healthcare providers that younger women who do present with a strong family history, a compilation of known risk factors, could in fact be at risk for a heart attack despite their being at a younger age. And I think it's important that we raise awareness in the emergency department as well as local care providers. In some of our prior qualitative work where we actually had women tell us their stories, these are women who had a heart attack, they talked about how they would call their physician's office and instead of being sent to the emergency room, in fact, they were given an appointment several days later. So I think that we often target the individual, that we need them to recognize their symptoms faster, we need them to get in the doors quicker, but I think there may be a role of the healthcare system to help facilitate that. When they hear the signs and symptoms of a young woman who is either presenting in the ED or calling into a physician's office, it needs to be on their radar that they need to think about the fact that this could be an individual at risk. So I think that it's two sides to this coin where we often think it's on the onus of the individual, but I think we're identifying in our work that there is also a component that's being contributed by the healthcare providers.